Greetings. In this video, we will learn about neurogenic bladder. It is a condition in which the nerve supply to the bladder and the muscles which help us in controlling the passage of urine are affected. Before we learn what is abnormal, let's find out what is normal. This is what our urinary system looks like. It consists of two kidneys, ureter, this tube that you can see, and the bladder. The function of the kidneys is to filter out the waste product from the blood and to form urine. This urine then travels through the tube, which are called ureter, to the bladder where it is stored and is eventually relieved during urination. Bladder is a special organ which is able to hold urine without increase in the pressure, as you can see here. So this bladder has the capacity to enlarge. Its elastic nature allows it to hold more and more urine without much increase in the pressure. This is important because of the high pressure. We may have very frequent urge to pass the urine, and also it may damage kidneys because this high pressure in the bladder is transmitted through these tubes to the kidneys. As the bladder fills with urine, it expands. Despite the bladder expanding, the pressure inside remains low. When the bladder is full, nerve signals tell your brain it's time to urinate. This leads to tightening of the muscles in the bladder and relaxations of the muscles in the outlet of the bladder. Here, the tightening of the muscles in the bladder helps urine to push out through this outlet, which relaxes and opens up. This is what happens in a person when the nerve supply coordinates the muscles of the bladder and the muscles of the outlet well. As you can see here, the bladder muscles have tightened and contracted, pushing the urine out through this outlet. In a healthy situation, your brain and the nerves in your spinal cord work together to control when you urinate. The brain sends signals to the bladder muscles to tighten and the outlet muscles to relax to help pass the urine. However, with neurogenic bladder, this communication is disrupted. The nerves that control the muscles of the bladder and also the outlet of the bladder are not functioning well. Because the nerves are not working properly, they can't send the right signals to the bladder and the outlet of the bladder, because of which the coordination between them is disrupted. As you can see here, this is a normal bladder, which when affected because of abnormal nerve supply, the bladder can either become very angry so that the muscles of the bladder are thickened and they're very strong muscles, or it can become very tired and the muscles in this bladder are now very weak. Now talking about the tube of the bladder outlet, which is surrounded by the muscles that control this area. The muscles that control this area can either become very strong so that this area always remains tight and is not able to open properly, or it can become very relaxed so that this area does not close at all and it is difficult for a person to hold urine because this area is always open. Therefore, it is important for us to ensure that the kidneys of the child do not suffer any damage. So in conditions where the bladder outlet is very strong and is not able to relax properly when we are passing urine, or the bladder is very thick that holds the urine under very high pressures because it loses its property to be elastic, that is, it is not able to expand as we store urine, then the bladder pressures can increase rapidly while the kidneys are producing urine, and this can in turn damage the kidneys permanently. Simply understood, if the bladder is relaxed or is tired, it is not able to clear out the urine, or the muscles which are on the outside of the bladder are very strong, will again not let the bladder to empty itself completely. As you can see on the screen, this bladder, which is not able to empty itself completely, seems to be in a lot of distress. Now we will understand the role of your doctor or your pediatric surgeon in making your child's condition better. So, the role of the pediatric surgeon or your doctor is to ensure that the kidney function is maintained in these patients, and also that the child remains continent and is able to live a healthy, normal life. Patients who have a very angry bladder, that is, bladder which is thick and is active, such patients are not able to hold urine for a longer time. Or even if they do hold the urine under very high pressures. Therefore, it is important that these patients go to washroom regularly and do not hold urine for a long period of time. Patients who have a bladder that does not empty fully, depending upon the condition of the child. The child may either benefit from double voiding, which is an act in which the child passes urine and then again passes urine after a few seconds to a couple of minutes, so that whatever remains in the bladder can still be removed. However, even after the double voiding, if the child is not able to empty the bladder completely, the doctor may teach how to insert a tube intermittently into the bladder of the child so that this bladder can be emptied completely, artificially, and on a regular basis. This is called CIC, clean intermittent catheterization, that is, insertion of a tube into the bladder. This has to be done on a regular basis so that the bladder remains empty and happy. Furthermore, in these patients, the doctor may prescribe some medicines which can help this bladder to relax and again allow the bladder to hold urine at normal pressures so that this angry bladder can become a happy bladder. Lastly, if all these measures are not able to relax the bladder and it is still causing damage to the kidneys because of high pressure, then the pediatric surgeon may perform a surgery on the child. It is important that you regularly visit your doctor to see whether the child is having a good response to therapy and also that the function of the kidneys is preserved. Since the nerves that control the bladder or the act of urination also control the act of passing stools, therefore, these patients may also have some problems in passing stools, which can be seen in forms of constipation or soiling, which will be discussed in another video. Thanks for watching the video.